We are seeing an increase in COVID-related deaths and hospitalizations throughout the state.
Healthcare professionals say the rise isn't yet overwhelming our hospitals, but it is something to keep track of. News Center Maine's Raya Wooten spoke with some providers today about their concerns. She joins us live now from Portland. Raya.
Brian and Amanda, medical professionals say they have the tools to keep this increase in COVID-related deaths and hospitalizations under control, but they also stress that everyone has a role to play.
There's an uptick in COVID right now in Maine, as well as across the country.
According to data from the Maine CDC, from June 2nd to June 29th, there were only 3 COVID-related deaths in Maine. But in the last 4 weeks, those numbers have increased. Maine CDC's weekly report shows there were 8 COVID-related deaths between June 30th and July 27th.
The COVID virus, we often feel like we're done with it. It's not done with us.
Dr. Patrick Connolly at Martin's Point Healthcare says he's hearing from patients who have COVID daily, and he's written his fair share of prescriptions for medicine that treats COVID symptoms.
The vast majority of people who have COVID aren't all that sick.
Connolly points out that people who have recently received the COVID vaccine often have an easier time fighting off the virus, but vaccines wear off over time.
If it's been several months or more since your last vaccine or since you've had COVID, your immunity, your ability to fight and that infection from hitting is significantly reduced.
And for those at high risk with COVID, you probably are going to need to get a COVID updated vaccine about every 6 months.
People who become really sick end up checking into the hospital. Maine Health's Chief Health Improvement Officer, Dr. Dora Mills, says since the uptick, there have been between 20 to 40 people hospitalized for COVID every day in Maine. But those numbers are much lower than hospitals in the state saw at the height of COVID.
During the height of COVID, hospitalizations in Maine, about early 2022, we had about 500 people hospitalized.
Still, Mills says everyone needs to do their part to keep themselves and other families safe.
So we have to put this in perspective, but also keep in mind that these are not just numbers. These are also people who are loved ones, and it's always sad when we see somebody hospitalized.
Dr. Mills says doing your part means staying home when you're sick until you've gone 24 hours without a fever, washing your hands, and also wearing a mask when you're not feeling well. Live in Portland, Raya Wooten, News Center Maine.